We've already done part 1 on YouTube as well. Let's talk about the treatment of high blood pressure. When we talk about the treatment of hypertension, we'd want to divide it off according to age. So we'll have anybody who's less than 55 years and anybody who's greater than 55 years. And both of these would happen to have an or along with. So less than 55 or a diabetic, greater than 55 or Afro-Caribbean by ethnicity. Right? So treatment depends on age, less than 55, greater than 55. Less than 55 has one or, that is a diabetic. Greater than 55 has one or, that's Afro-Caribbean. Now, it's again divided into steps, the treatment. The first step would be one drug. So step 1 would be one drug. If we were to talk about anybody who's less than 55, we'd offer them either ACE inhibitors or ARBs. And if we were to talk about anybody who's greater than 55 or Afro-Caribbean, we'd keep it simple and offer them calcium channel blocker. That is step 1, when there's one drug. Step 2 is when we have two drugs. For two drugs, if you've already added ACE inhibitor or an ARB, the other option would be to cheat on your right side and add the calcium channel blocker. If you already had the calcium channel blocker, the next option would be to add an ACE inhibitor or an ARB. Now, either you can do that, or if you had ACE inhibitor or an ARB and you decided to jump off the calcium channel blocker, you added a diuretic instead. Similarly, if you had calcium channel blocker, you added diuretic along with. Either way, you've got two drugs at step 2. Next up is step 3, where you can have 3 drugs. So now here it doesn't matter if you started off with an ACE inhibitor or if you added a calcium channel blocker, because the third drug would be a diuretic on both sides if we're following the traditional one. So it doesn't matter if you've added calcium channel blocker, it doesn't matter if you added second as ACE inhibitor, and then we'll have diuretic as the third one. That's the third treatment, the third step. The fourth step is where we bring in potassium. So it's potassium related. And it's the same for both less than 55 or greater than 55. If somebody has a potassium of less than 4.5, then we'd want to talk about spironolactone, because they are potassium sparing. And if somebody has a potassium of greater than 4.5, that would be alpha or beta blocker. So that's the treatment of high blood pressure summarized in one table. Depends on age, starting off less than 55 or greater than 55. Both of them have one ORs on each side. Less than 55 or diabetic, greater than 55 or Afro-Caribbean. Starting off for less than 55 or diabetic, because always remember that ACE inhibitors are protective against the kidneys, and that is why in diabetics we'd want to start on an ACE inhibitor, because they're protective. So for diabetics less than 55, it's going to be ACE inhibitors. Greater than 55, Afro-Caribbean, calcium channel blockers. Step 2, add up the other drugs or add in diuretic, but has to be 2 drugs at the end of the day. Step 3 has to have all 3 drugs together. Doesn't matter in what format. So ACE inhibitors, calcium channel blockers, diuretics. Step 4 depends on the potassium itself. Potassium less than 4.5, we go for spironolactone. Potassium greater than 4.5, alpha or beta blockers. I think one other thing that's mentioned in the NICE guidelines along with all of this is that if we've got, for example, where, let me change the color of my pen. So we're somewhere here, we've got somebody who's not less than 55 but is Afro-Caribbean by ethnicity, and we've started them on calcium channel blocker. If we were to step up, we can go to ACEs or ARBs or diuretic. For example, if we want to go forwards with ACEs and ARBs, then in Afro-Caribbeans ethnicities, ARBs are more preferred than ACEs, as per the NICE guidelines. So I think that's something that I'd wish, if somebody that I'd want somebody who's read the guidelines to know about. So that was my take on high blood pressure, the stages, the treatment, and the diagnosis, the screening, and the investigations. I hope you liked it. If you liked it, please like and subscribe the channel, and we'll meet again next week with another topic. Take care. Bye.